Hello, everyone. It's July the 20th, Monday. Good thing to report right off the get-go is we have had no additional deaths since last Friday. That's wonderful news as far as I'm concerned, and I'm sure good news throughout our state. Bad news is we have 100 great West Virginians that we've lost, and that's just 100 flat too many. That's all there is to it. Yesterday, as far as our numbers in the state of West Virginia, we had 89 positive new cases. Our daily rate, dropped significantly down to 2.16 from where it's been running in the low 4s to high 3s, and so we're happy about that. We now have 394 cases in Mon County. We've increased by, I think, 4 since Friday. That's good. Kanawha County has 171 cases. That's the second highest in the state, and it's 47% higher than it was. It's increased by 47% over the last month. So we got to really keep a close eye on Kanawha County, and we don't want those numbers going up, that's for sure. I want to tell you just this. I was watching one of the newscasts, actually this morning, early this morning, probably about 5 o'clock this morning. And one of the reports came across that Kentucky, yesterday or Friday or the last day that we know about, Kentucky, and it's really important to think about Kentucky because constantly in all of our bordering states, whether they be, Kentucky or Virginia or Ohio or Maryland or Pennsylvania, always in those surrounding states, the border states, Kentucky is the closest to us all the time. Now, what I'm getting to is imagine this. Yesterday we had 89 positive cases in West Virginia. Earlier, the tail end of last week, we had days where we had 148, 127, and those kind of numbers. We are absolutely worried about this thing migrating from the south because we know what's happened in Georgia and South Carolina and Florida, Texas, Alabama, Arizona, all those states, Tennessee. We all know, just the other day, the Tennessee governor said they were at a positive rate of in excess of 10%. But now just get this, and I always believe it is really important for you to have the knowledge. Yesterday in Kentucky, they had 979 positive cases. 979. In West Virginia, when we're seeing cases like 100 or whatever like that, we react and we try to get out ahead of it. Now, and that's what we're going to continue to try to do. 979 cases from the very state that is the state that has been tracking the closest of all the bordering states to us is alarming. So we're going to continue to watch, and we're going to continue to stay on top of this. I surely appreciate everybody wearing their mask when they go out and they're going into a building, and I also underline, if you have a breathing issue, a COPD or whatever like that, this mask mandatory mandate was not for you. But everyone else, if we'll do it, and we'll do it in a good way like we're doing it, hopefully we'll start back down with these numbers and we'll continue to be able to do everything that we like and we want to do in the state of West Virginia. I've got a thing to report here about workers' comp. Our workers' comp rate is now going to decrease, and I love this totally to death. It's going to decrease on an average basis for all of our companies in West Virginia, a decrease of 8.3%, and that's going to become effective on November the 1st. The premium reduction results in a projected $16 million in savings to West Virginia employers, and that will help our businesses, and every little bit helps. Now that, so basically it is a 8.3% decrease in cost. So we're really happy to be able to report that. On our small business grants, as we move forward with our small business grants, the applications are open. I think, Jordan, if you'll put that up on our website and everything, for anyone that has an employee, 1 through 35 employees, we're still working on the possibility of, the sole proprietors that just pay themselves with profits that are made in the business and don't really technically have an employee, even though that they could very well just be paying themselves. Nevertheless, we're trying as hard as we can to push out the door $5,000 to each and every one of these small businesses, and hopefully we'll have dollars left over that we can come back and push out even more dollars to them. Okay. On our CARES dollars that are going out to our cities and counties, we're now, in excess of just under $50 million. We've had 155 cities and counties that have applied. We're still wanting more and more applications and more, cities and counties to be able to apply. So the faster you get them to us, the faster we'll get the money out. We'll get the money out, and we'll have lots and lots of discussions with you and get the money out from the standpoint of what are the guidelines that we can go by. Tomorrow, I am having another call with, this will be the third call in regard to our public and private colleges and universities. I've had 2 previous meetings. All of us, Shirley, myself included, all of us want to see our kids back on campus and see our kids back in school. One of the things that we have to do is because it was brought to my attention, we have to be sure that we test every student that is coming into West Virginia from out of state. And we are absolutely mandating that we're going to do exactly that. Now, as far as additional discussion and everything, we've had a lot of discussions. We are doing absolutely what I think has to be done. And that is we're watching what's going on in our nation. We're watching what's going on, in our state with our numbers. And we're absolutely trying with all in us for our kids and kids to get back in schools. We've got to have our colleges and our universities and our private colleges and everything. Absolutely, we have to have them. And so, without any question, we're trying with all in us to be able to continue the education process for kids and to be able to perpetuate our colleges, our private colleges, our public colleges, and our universities within this state and support them. So we're working on it really hard, and tomorrow we'll have some more dialogue, more information. I want to report to you now we have 7 churches, we have reported outbreaks of churches in 7 counties: Boone, Grant, Logan, Kanawha, Raleigh, Taylor, and Wood counties. These outbreaks account for a total of 75 cases, and we've absolutely got to stay on top of this with all in us. Please, please know that the church setting is the ideal setting to spread this virus. Please know that. We have said repeatedly, a pew in between us, some level of social distancing, absolutely social distancing away from those that aren't in your immediate family. And the other thing is just this: you have got to wear a mask in church. I know it's hard to do. I know that's really difficult to do. But for right now, that has to be done. Because if we don't, all we're going to do is perpetuate this terrible killer into more and more and more people, and we're going to lose people. We're going to lose people, and a lot of elderly love to attend church and everything, and we could very well lose a lot of our grandmothers and grandfathers and people that have so much wisdom to still continue to pass on, and we absolutely don't need to be losing these people. I've got a few things more, but not many. Our summer feeding program, we don't want any West Virginians to go hungry. We've got 690 sites. If you're having trouble trying to figure that out and everything, call us on 211 and we'll assist you. The free testing continues this week. We're in Logan County, and we will also be free testing in Brooke County later this week, and details will be released pretty soon. You know, again, the free testing is just that, it's free. We wanted to target the minorities because, you know, there's issues there with the minority community, maybe disproportionately having more people that are infected by this killer and more deaths. So we want more information there, and we want more information from the vulnerable. But if you are asymptomatic and just anxious about this or believe you need a test, go get a test. Again, I remind everybody about our census. We don't want to mess that up in any way. We want to continue to stay on top of that, and we want to do better than what we've been doing and keep that up. Now, from the standpoint of our nursing homes, we had another case that just happened in the Pendleton Manor Nursing Home in Pendleton County, and it happened over the weekend. When I got word of it, it was on Sunday. I immediately called the guard to go there and test everyone. They are there right now testing everyone at that nursing home, and again, that's how we run to the fire, and we want to be able to continue to do so at nursing homes or wherever it may be, provided, you know, we get calls and everything and says that the situation is not being handled, maybe, you know, or the situation's under control or whatever the situation may be. We got to have feedback from the nursing homes, and then we'll come running to the fire immediately. The only other thing I have is just our charts, and I want to show you just this. If I could show you this real quickly, if we could put them up. If you'll look, the top chart has bent a little bit back our way. There's 3,400, you know, cases that now are recovered cases, and 1,580 that are active cases, and it's starting to trend a little bit our way, but we need more and more of that widening. You can see how it was much wider before, and we need more and more of that widening. You know, now, from the standpoint of the second chart, our daily percentage of positives, you know, we have dropped down. You can see it there, turning down. That's what we wanted to do. Right there is exactly what we wanted to do in the middle chart and everything. The daily positives yesterday were 2.16, and that's one heck of a lot better than where we've been. And so if we can keep that moving that way, that'll be really good. And you can see the same thing with our cumulative down there. We wanted to go back now. We got a little spoiled by being under 2%. We want to stay spoiled. You know, we want to absolutely even get more spoiled. And so let's get it back under 2%. I think we're starting to, I hope and pray, we're starting to see things move a little bit back in our favor. And the more that we persist in wearing the mask, the better we'll be. And just come on, West Virginia. You've done it and done it and done it, and you're the ones. You know, I can sit here and say whatever and try to be proactive and push all the right buttons, but at the end of the day, you're the ones that make it happen. I've said before, this right here is the only bullet in the gun today, other than shutting stuff down. You know, this is all we got. Eventually, this will become a buggy whip. As far as the buggy whip factories, you know, if you'll think a long time ago when we rode horse and carriages and everything, we had to have buggy whips, and there were buggy whip manufacturers. Today, we don't need buggy whips. So there's very, very, very few that are needed, and so that that industry became somewhat obsolete. Now, I know that there's, resorts and things like that have carriages and use a buggy whip from time to time, but, I would tell you just this. Let's hope and pray that for us in our daily, everyday lives, this becomes obsolete. Today we need it, and today it's a lifesaver. So keep wearing your mask, keep doing all the great stuff you're already doing, West Virginia. We're going to get through this. We're going to get our kids back in school, we hope and pray. We're going to be able to play football and do the things that we love and are really fun and exciting for our communities. And we're absolutely going to get through this. But right now, we don't want to back up. And so keep doing all the great work you're already doing, West Virginia. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And certainly, as the governor has articulated, we are still doing well from the standpoint of COVID-19, but we also know that we can't be complacent. As we look at states around the country, we know that states like Kentucky, South Carolina, Louisiana saw their highest total number of new cases of COVID-19. We also know that a number of states, including Idaho and Iowa and Nebraska, have seen a 40% increase in the number of people dying from COVID-19 in their states. And we also recognize that for the 41st day in a row, a rolling 7-day average of new cases of COVID-19 continues on an upswing in the United States. Now, many people are confused by a lot of information that's out there on the social media and also in the news about COVID-19. And while there's a lot of different people that can look at the same information and come up with different explanations, different narratives for that, what we're really trying to do here is not to bias and say, oh, we just think this, so we're going to try to convince everybody to do a certain thing. We're really trying to look at what experientially, what has happened in places where either you did certain things or didn't do certain things related to COVID. And there's lots of literature out there, but I think it's really clear, at least to me, from my own lens, from the way that I look at information, that masks are an absolute, very, very powerful ingredient in fighting COVID at its roots. Because what we found, just to be very simple, over the past 6 to 8 months, is the fact that initially we thought maybe COVID spread more from being picked up off inanimate objects like counters or buttons on an elevator or water fountains. And now we know, I think pretty convincingly, that COVID is spread by droplet transmission, by people talking or singing or breathing hard or laughing or even just breathing normally, that we all generate these droplets. And the more indoors that we are, the closer we are to each other, the more we're interacting with large numbers of people, particularly inside versus outside, and importantly, without masks, which again, reduce the amount of droplets that you generate, that we know that COVID spreads faster. And we also know now that at least half the spread, and maybe more, is done by people that don't know they have COVID-19 in the pre-symptomatic phase, which as much as 2 days before you get symptoms, you can be infectious. So ultimately, making sure people wear masks, that we're doing a lot of testing, that we're identifying those people and trying to reduce their exposure to other people, these super spreaders, is really what we're trying to do. And a new article just came out that said that countries that went to very rapid deployment of masks have seen 100-fold reduction in mortality. And if we look at Southeastern Asian countries, we notice that they have oftentimes double digits of mortality, despite being millions of people in population. And we look at countries like Sweden that has taken a different approach and see that they proportionally have had many more people die. Now, ultimately, again, we all look at information differently, but as a state of people who love each other, who believe in community, who've served the country in many, many ways, it is really clear to me that West Virginia has that opportunity to continue to be the beacon by caring deeply about each other and showing our altruism and our service in our community by wearing masks, staying physically distanced, and making sure that we are protecting ourselves and protecting each other. So thank you.
Good, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. Just wanted to close the loop on a question we had after the press briefing on Friday. Let everyone know that Dr. Amjad and myself have both been tested and we're negative. So that we'll make sure that that's out there and clear. With that, Dr. Amjad.
So to go over the churches, we have 7 counties and 7 churches that had outbreaks, but we want to go over the fact that as your state health officer, that we want to encourage everyone to still have online services if possible, but we are going to lend our support for the churches and to encourage social distancing and to use masks. But if you're going to still meet, that we want to offer our support for them, to encourage face shields if possible, that we are here for you to work with you and to contact us if you have any questions.
All right, thank you both. And finally, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out in response to his initiatives on rapid testing response, we are providing support in Pendleton County as well as in Kanawha County today, and some rapid test support to state agencies. Also on the sanitization missions as follow-up to those events, sanitization missions at the state capitol, providing support to Kanawha County, and as well as the state lottery facilities today. Our team of subject matter experts are also continuing to support county school boards with their drafting of reopening plans, and we have had some success with securing some additional PPE. So we continue to work towards our 180-day supply of PPE. I just want to reinforce the significance of, again, from a guard perspective, of why the governor puts initiative and effort into the testing and the PPE and wearing a mask. In our own force, as we begin to test National Guardsmen across our force to make sure that we maintain the health and safety of our force to be able to support you, the citizens of West Virginia. We have identified asymptomatic guardsmen who tested positive, and because of the discipline that we are using with our PPE, we have significantly limited any challenge that that's created to us as a force and protected our members. So we appreciate all the effort being done by all West Virginians to mitigate the spread of this virus. Thank you.
Thank you, General. We'll now go to questions from members of the media. The first today is from Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor. I was wondering, with the president's change to how hospitals are reporting data, I was wondering how that affects West Virginia. Are hospitals still reporting data to you all, the state, and then are you still reporting data to the CDC at all? How does that work?
Taylor, I think I understood your question, but Bill, if maybe you can answer that, better than anyone.
Yes, sir, Governor. We have such a great relationship with the West Virginia Hospital Association that we're confident our data is going to continue to come directly from the Hospital Association, and that we will be able to maintain good data going forward with regard to hospital utilization, ventilator use, ICU occupancy, et cetera. So there are some changes there, but we're working with the Hospital Association and making sure all reporting is done as it's supposed to be done. There's some concern about the changes, but we're working through those.
All right, thank you, Taylor. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, all. This is Emily Allen with West Virginia Public Broadcasting. My question would be for Secretary Crouch and Dr. Amjad, and also the governor. Do we have additional information on the church outbreaks? I know you mentioned it, but can you specify where they are, maybe which locations the most cases have occurred, and whether all 75 cases are active right now? And I also want to ask Governor Justice, with your mask mandate for indoor spaces, are churches included in that order?
Okay, Dr. Anjan and Bill, maybe y'all could start.
Sure. Emily, sure. Well, we have 7 counties and 7 churches, and I have some numbers in front of me, and they range from anywhere from 5 cases to 8 cases per church and county. So of the 7 counties, one church per county, to answer your question, and we have anywhere from 5 to 8 people per church. And to answer your question, I mean, the mask mandate does apply to churches. And the issue that we have is that, we don't want to single out churches or places of worship, because a lot of these places have been trying to wear masks and socially distance themselves. So we don't want to single out any religious place or any place of worship. So they have been trying. We want to offer them our services as far as healthcare and ways to, socially distance, but they do have the mask mandate. Some of them have been trying to socially distance and working with them. So we're going to continue to work with them and offer our services, but anywhere from 5 to 8 people have been in those areas.
And Emily, I think it was Emily, if I could just add this, that we strongly encourage everyone in our churches to have a mask on. Everyone, and do all the social distancing, the pew separation and all that stuff. I can't just say it enough. Our churches are probably the number one thing in our lives. And I get it. I get it wholeheartedly. And I know how difficult it is to wear this mask and everything. And I surely know how difficult it would be wearing the mask trying to sing. So I understand it through and through. But absolutely, and I want Dr. Marsh to bring someday the video that shows how these droplets spew and go all over the room and all over places and everything. It is so easy. If I were to draw up a scenario, I think Dr. Marsh has said it many times, and I said, how can we best spread this disease? Can we do it best in Walmart, where we're walking through Walmart? Well, sure, we can do it there, but that's not the best place. Can we do it best, if we're getting gas at a Go-Mart and we're running in there? Can we do it best at a drive-through window? Can we do it best at a sporting event? Or can we do it best by sitting in a place to where the air's not really moving, and people are projecting their voices, and we're absolutely not, and we're there in that one spot for an hour or more? That's a church. And that's what we're dealing with. And that's why we tell you that it may not be the best place to absolutely perpetuate this disease, but it has got to be very, very high on the list. Naturally, our best place for what we know are the bars. And so, but our churches are surely high on the list.
All right, thank you, Emily. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, I want to ask about universities and colleges that you mentioned in your opening statement. What exactly will be the plan, to your knowledge, and perhaps Dr. Marsh, you could weigh in if you're aware. What exactly is the plan for incoming students into WVU and Marshall this fall? Will we be testing everybody who's coming in, or just out-of-state people coming in? And if it is the latter, then medically, that raises questions about, well, how effective is this going to be because people in West Virginia obviously are vulnerable to this and can get it. And I guess the main gist of it is, if we're testing 20,000 students at WVU and 10,000 students at Marshall, that's 30,000 test kits for a snapshot. And then that night, all 30,000 of those students can go out and get infected with COVID. So would that be the best use of our limited testing resources in splurging them all in that venue? Thank you.
Okay, Kenny, your question is multifaceted, but I'll give it my best to answer just this. We all know, and I'm not running from any part of the question, but we all know that this is a moving target. We all know that this situation is fluid and you can only do the very best you can possibly do. I can tell you that these universities and colleges have done so much work to protect their staff and these kids. It is unbelievable, the plans of how complex and how absolutely rock solid these universities' plans are. Now, from the standpoint of testing everyone from out of state, I absolutely believe we should do that. From the standpoint of doing like what is being done at Appalachian Bible, where they can do it, they're bringing the students in and they're holding the students for 14 days before they progress with doing other things. Other people have other ideas and other ways that they can do it and do what they're planning to do as safely as they possibly can. There is so many different gyrations of what can be done here that absolutely, to just say, well, if we tested 30,000 students, and I think WVU is planning on testing everybody, but if we tested 30,000 students, we would be running out of testing supplies. Well, that's not the case. That's not the case because of the great work from DHHR and the great work from our National Guard. And so we want to continue to try to test and test and test and test and have more and more and more tests and tests available. WVU is going to be online with their testing, we hope, in the very early days of August and everything, to where that will be another dimension where we'll be able to test more and more and more. But the long and the short of it is there is no perfect answer. We don't have a perfect answer. But at the same time, we absolutely want our kids back in school. We don't want to lose our kids to other states or lose them to this terrible drug epidemics or we surely don't want to think about the dreaded suicide rate. So absolutely, and we do know that our younger people, have surely been infected the least or have the least symptoms from this. So there's so many different things to try to consider. And so with all that, everyone, and I super commend, Sarah Tucker, Gordon Gee, all, Jerry Gilbert, all the different people from Dan Anderson to on down through all the different colleges and all the stuff that they're doing. They're doing really, really, really good stuff. And let's hope and pray that what they're trying to do is get us back in school and get us back in school for one semester. And at the end of that semester, we'll have a vaccine. Let's again hope and pray, and then we'll be off and running.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you give us your thoughts at this point on extending the Mon County bar closure? I believe the 10 days is up at the end of the week, and I was just wondering if you could give us a little insight into what you're thinking about that at this point as we continue to see numbers in that area tick up. Thank you.
Charles, right now, if it was the end of the week, I would extend it. There's no question that we still have an issue in Mon County. And right now, if we were at the end of the week and we're still reporting numbers like we're reporting, I would extend it.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. This is a question I've asked Superintendent Birch before, but I want to approach it here. Can you specifically talk about how CARES Act money will go to support the schools in West Virginia? I know the union, teachers union, is making some calls today. A few things from that: will all kids get a computer or tablet? How are health screenings going to be handled? Will we be able to increase the number of school nurses? And is there any thought to additional staffing, because teachers are going to have a tremendous task of getting kids back up to speed? Thanks.
Okay, Amanda, I hate like crazy that we drift into politics, and I hate we drift into ignorance, to tell you the truth. But today, the Department of Education has received, now get this number, the Department of Education has now received $94 million of federal money to be used for COVID-related expenses at our K through 12 schools. It doesn't have anything to do with our CARES Act at all. It has nothing to do with that. But they got $94 million right now to be able to use, that with COVID-related issues for K through 12. Amanda, everybody wants to start running in a direction and everything and saying something when they don't have any idea what in the world they're even talking about. At the end of the day, it's a political football. It's a political season. You're going to get a bunch of this. Clayton Birch and our Department of Ed is going to continue to do really, really great work. They're planning on stuff with each and every county, in a way that they can help them and do great work. And that's what they're going to do. So I've got to defer again to the experts. Our experts in this area are our education community, our education people and everything, that Clayton Birch and all of his people. So they're on it. They got $94 million. When they spend $94 million, if we need more money to try to help our kids, we'll find a way to get them the money.
All right, thank you, Amanda. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. I want to stay with the education theme here. How much pressure are you and the school system under to open on that September 8th in light of child care problems that could occur if school is not in session?
Well, Paul, it's Paul, is that correct? Paul, I wholeheartedly want our schools to be open. And I've pushed back the date as far as I think you can do it and still get our school year in, in a way that is as close to normal as we can do it. But Paul, here's the whole thing. Whether it be the daycare issues or whether it be whatever it may be, I'm absolutely not willing to put those children back into school or our teachers and service personnel back into school and back in those environments unless I can feel absolutely certain from the experts, from the education experts, from our medical community and everything, that everyone is on board saying, absolutely, this is safe and it's the thing to do. Now, with that being said, I am all in wanting us to hit that date and be back in school. But I am not going to receive pressure. I'm going to listen. I'm going to listen to good ideas and good smarts and everything, but there's not going to be pressure. This is going to be a collaboration with our experts and the safety and the well-being of all of our kids and all those teachers and all the service personnel that we can do this. And I truly believe with all in me, we're going to be back in school on September the 8th. And we're going to be back playing football. I believe it wholeheartedly. And we're going to be playing our fall sports like soccer and volleyball. And we're going to be doing that. And I believe that we may have to be wearing masks and we may be limited crowd, that will be able to be there and those kind of things. We may have to live through some inconveniences, but I believe we'll be back in school on September the 8th.
All right, thank you, Paul. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, on Friday, you and Dr. Marsh pointed out some of the falsehoods that are being spread about COVID-19, and one of those falsehoods was that the recovery rate is about 99.7%. In his interview yesterday with Chris Wallace, President Trump repeated that 99.7% recovery rate. Since you're friends with the president, do you feel an obligation to try to set him straight on spreading misinformation like that?
Well, Phil, first and foremost, I have no right to set the President of the United States straight on anything. But I can tell you that I think what he's referring to, and Dr. Marsh can explain this better than I think what he is referring to is the total number of cases. And Dr. Marsh, if you could take over right now, because you can explain this the very best as to what number he's using, and he's just using a different metric than what I'm using. But anyway, Dr. Marsh, if you could step in there.
Well, thank you, Governor, and thank you, Phil. There's a lot of different ways to look at information. And there's been projections from places like the Centers for Disease Control and others that if you strip away everything and you start to look at purely people with COVID without other diagnoses and looking only at people that die specifically of COVID, then the mortality rate that we're seeing would actually be lower. And that really goes at the complexity of tracking something that's been so sudden across the world. So the president certainly has access to many pieces of information from many different resources. And as I said before, the same people or different people can look at the same information and come up with different ways to look at it. The way that we're looking at it, and certainly what the governor and I reflected on Friday, is if you look across the world using CDC data or using the COVID tracking projects data or other resources, then the mortality rate in our country is about 3.8%, and the mortality rate across the world is about 4%. Now, if you identified every single person that has had or has COVID, and you are able to increase that denominator, then I think that many people feel like that the true mortality from COVID, if you don't interfere with the health system, et cetera, is probably around 1%, maybe on the lower side or a little bit on the higher side. But I think the president is quoting some additional information that he has access to, which looks at, if you look at everybody, and you could really specifically get down to only people that died specifically of COVID, then those numbers might be much lower.
And Phil, if I could just follow up by just saying this. Just imagine this. Imagine if you were in this chair, or imagine if you were in the president's chair. Imagine the volume of information that's flowing to him and everything. And you're right, we are friends. I have no right to instruct him on what to say and what not to say. I mean, that would be preposterous to think such a thing as that. But I can tell you this, that in my heart, really and truly, he catches it from a lot of different angles, especially the media, that absolutely want to look at a 1,000-pot thing and try to find the one thing that is a fallacy or whatever. It's not fair. I mean, it's not fair. That's just all there is to it, because the man is doing a marvelous job, and I've got to always defend my friend, and he's surely a friend.
All right, thanks, Phil. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, it's Steve Adams of Ogden Newspapers. And this is a question for Dr. Marsh, perhaps. I've seen this pop up on my Facebook page recently, and normally I would have written it off, but it came from the National Institutes of Health. So I found it to be interesting, and it was a study that was done on melatonin as a possible treatment for COVID. And I was curious as to if Dr. Marsh could explain that, if you're familiar with that at all, and if nothing else, talk about some of the treatments that we're kind of seeing slowly kind of come out that's really kind of keeping the death rate in a lot of places lower than what it had been. Thank you.
Governor, are you okay with me taking that?
No, please.
Okay,
Doc.
Great. So thanks for the question. I think that there's really two categories of information that's flowing now around different kinds of treatments that might be effective for COVID and treatments that have been demonstrated to be effective for COVID. So certainly as we look at a variety of drugs, I know that there is evidence out there, information about cholesterol lowering drugs, certainly information about drugs that might affect the metabolic cycle, which is important in sleep, the COVID seems to interfere with some of the metabolism of certain kinds of sugars and fats. And so drugs or other hormones that might impact that may very well have a beneficial effect in slowing the reproduction rate of COVID and the infectivity rate of COVID in people. And those are generally studies that have been demonstrated more in cells, or having look at a group of people and kind of looking backwards and saying, well, what was the commonality of drugs that these people were taking that perhaps others weren't? But those have not really been proven in clinical trials. What you have mentioned on the other side was that we are getting better at understanding how to treat people with COVID. So for instance, in the intensive care unit, when COVID first started, because of a really powerful effect of COVID infection on some people's oxygen levels, people were immediately placed on mechanical ventilators, breathing machines. But now what we understand is the problem maybe in the blood vessels as much as in the lung. So trying just to add a lot of oxygen, but not using a ventilator that can deliver more pressure to the lungs and injure the lungs independently has become important. We also understand that drugs like dexamethasone, which is a corticosteroid, a really powerful anti-inflammatory drug, seems to be able to help people in the ICU. About 1 in 8 people get through their illness much better by maybe suppressing, reducing this inflammation people see. We also know that blood clotting is very important in people who get desperately ill with COVID. So using blood thinners and looking for blood clots is important. And then we have a drug, an antiviral drug called remdesivir. I'm having trouble saying it now, which is important in reducing the virus's COVID-19's ability to reproduce. So there's many things that have improved outcome that have been proven. Some early drugs that we thought would work have been shown maybe not to work as well. But I think what you're seeing is both on the vaccine level, on the drug level, and then also the intervention level, the convalescent plasma, transferring blood products from people who've had COVID and have an immune response to people that are sick with COVID has also made a difference. So we're really starting to evolve our strategies and understanding better. And as the governor said, we believe that's going to continue, which will give us an even better opportunity to deal with COVID effectively and hopefully even prevent COVID infections better in the future.
Gordon, come back to me just 1 second. Stephen, let me add just a follow-up to Dr. Marsh. Late last week, I got wind through the medical community of a doctor in Texas, and I'm sure Dr. Marsh knows about this doctor, but a doctor in Texas that was treating the patients, instead of treating the patients with an inhaler for these lungs or whatever like that, he was treating the patients with I guess a steroid, and I'm not a doctor by any stretch of the imagination, but it was a steroid that was to reduce inflammation in the lungs, but he was treating them with nebulizers. Now, and he was having amazing success, according to him. So I picked up the phone, and after I found a whole lot more about him and everything, and I called the Trump people and a lot of those people, and sure enough, then of all things, I think on one day over the weekend, there he is on television talking, to someone, I can't recall if it was CNN or who it was and everything, but he was talking about the treatment that he had and what he was doing and having 100% of the people with no deaths, So anyway, all I'm saying is just this. When I called the Trump people, just like I suspected, they were already on it. They already knew about this. They were already looking into this and everything. They were they knew everything that I knew times 10, and they were all over it and they were working it. But you see, that's what's happened, Stephen. There's lots and lots of different treatments and everything that are going on right today, and we're getting better. We're getting better and better and better. And as we continue to get better, we're very hopeful, and I'm sure Dr. Marsh will follow with this, but I'm sure, we're very hopeful that we're going to reduce this killer to a common cold, a bad cold maybe, but a common cold. And then right behind that, we're going to hope and pray that the vaccine will be not very far behind that. But you need to check that out, Stephen, and look at that, because that was really some interesting stuff. But Dr. Marsh, if you could end that up, please.
Right. The drug that the physician in Texas is using is an inhaled steroid called budesonide. And it does reduce inflammation. It's been used a lot for children with asthma and other inflammatory airway disorders. And as we said before, and I think as the governor has said many, many times, and I have too, that the whole goal in reducing this surge and flattening the curve is really to buy us more time, initially to buy us more time to generate our own personal protective equipment and enhance our ability to deal with surges in the healthcare setting. But now it's also to buy more time to let these new and innovative therapies have a chance to take hold and vaccines to be developed, which are being developed actively in an amazing rate of speed right now, so that we can safely navigate our people in the state of West Virginia and the country and the world safely to the point where we can live with the virus or defeat the virus over some period of time.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet. I want to go back to a week ago today. We had the House of Delegates hosting a health subcommittee hearing on this very subject. Many of you were present there, and it was a crowded room, and one of the House employees tested positive. I want to ask about the follow-up testing that was offered to everybody that was in the room that day. Do we have any more positive cases? Do we have an outbreak, or was this contained to the one employee, especially because she was wearing a mask?
Our health experts, Dr. Amjad, Dr. Marsh, maybe Secretary Crouch, you guys answer this, please.
Governor, this is Bill Crouch. I do not have the details on that. I do not believe there were any other positives from that testing that was done in the Capitol on Monday. Dr. Amjad, you were?
Yeah. Hi, Mark. Yeah, from what we know, there weren't any positive cases, Mark. So she was wearing a mask. Everything.
Yeah. And if I can just re-emphasize that point, Mark, is that we believe that there's not been an outbreak because of the mask wearing by a majority of people that were in that environment. And we know that by reducing those droplets, we reduce the spread. And this is just a good, piece of experience for us, a good story, a good opportunity for us to reinforce the idea that as we take care of ourselves, we take care of each other, and that prevents the spread of COVID-19.
Yeah, Mark, and that is a great question. We'll get back to you tomorrow or Wednesday with the number of people tested, so you have a little more information on that for Wednesday. It's a great question. Thank you.
All right, thank you, Mark. We have time for one more. We'll go to David Beard with the Dominion Post.
Hi, I wanted to clarify the governor's answer to Charles Young's question. Mon bars are set to open Friday. Do you expect to hold off your decision until Thursday, or what timing do you have in mind? Thanks.
David, we'll hold off as long as we can, but we'll try to give you as much notice and try to give all those the bar owners and everything as much notice as we possibly can. We still got a ways to go to get out of this mess. We don't need to just bounce right back in it, and I'm very, very hopeful that we'll be able to, have our bars, our restaurants, and I know we haven't closed our restaurants, but I'm very hopeful that we'll be able to continue to keep doing things as close to normal as we can. But in that situation, we all know the number one most dangerous spot that we have right now is the bars. And in Mon County, we still got a pot full of a problem, and so we're trying to deal with it. But I do believe that all indicators right now are we're going to have to extend that closure.
All right, thank you, David. Governor, I'll turn it back to you.
Well, I only have two things real quick. One is the follow-up is coming from our people on Wednesday Mark Curtis's, question in regard to, was there anybody else infected in that situation that happened on, on the House floor or with the House members? If it didn't happen, does that not tell us lots and lots of stuff? What would have happened? What would have happened if she did not have a mask on? What would have happened if nobody in the room would have had a mask on? Well, the odds are tremendous that we would have had a really significant issue and a problem right now. Now, granted, we may still end up with some of those that were in that room infected. But right now, we look like we're going to get through that. Irregardless of either way, it would surely have been a lot less, or it's surely a lot less than the magnitude of the problem we would have had if she had rolled in there with no mask on and we'd have had no one in the room with a mask on. Look what could have happened. And so from that standpoint, it's a real tribute to the fact that we did move and we did have the mask on. So let's hope and pray there's no one else infected, and Bill's going to come back and Dr. Amjad, and they're going to give us more data, on Wednesday. And even if there are people that were infected, we sure know it was a heck of a lot less than what it could have been. And let's hope and pray that there's no one else infected, and this young lady gets well very, very soon. And our prayers, our thoughts are with her that she's going to be well and back to work, soon. Now, let me just say this. You realize that in the United States of America, we have now lost in excess of 140,000 people. That's as many people as 2 times the Vietnam Wars and multiple times what happened with 9/11. 140,000 people, and we're continuing to go north and north and north. We're going to be really, really, really lucky in the United States if we don't exceed 200,000. Now, Dr. Marsh is probably the leading expert in this state in regard to anything whatsoever to do with COVID-19. And he has given us repeatedly information that, to tell you the honest truth, is so intellectual at times, I'm struggling to keep up. But when you look at it and everything, and the bottom line to the whole thing is just as simple as just this. We have countries across this globe that have people that are stacked on top of one another. And as we're stacked on top of one another in certain countries, how are they not spreading this terrible disease like crazy? And the number one thing always falls back on just this. How in the world have we lost 140,000 plus people in the United States, in a country with multiple tens of millions of people have lost 4 or 18 or something like that? And the whole key is just one thing. They wear masks. They wear masks all the time. There's surely probably other things, from treatment to whatever it may be. But the bottom line to everything is just one thing and one thing alone. We fight the battles with what we can fight with. Today, we fight with this. Tomorrow, we may have to fight with something else. But today, we fight with this. And we fight with the knowledge of these great docs, Dr. Amjad, Dr. Marsh, all the people that we call upon. We fight today again with this. Now, I would end by just telling you just this too. I think all of the House staff, 49 people, the staff and members, have been tested and have come back negative in regard. I think that's the number from General Hoyer. But General, maybe you could end it up by, if you want to speak just on that, because, I just got an update on that number and I hope I'm right.
Yes, Governor, we just checked with our staff that did the rapid testing. 49 staff members from The House of Delegates and Capitol staff tested negative on Friday.
Can't be better than that. It's a good way to end. We thank that young lady for wearing her mask, and we thank all those that were present for wearing their mask. It's a good way to end. Keep up a great work, West Virginia. You're killing it. You're doing a great job. Keep doing the miracle over and over and over. The whole world's watching you. Just keep doing it. Very, very proud.